Last week, I had the great opportunity to attend the annual Menopause Society meeting that took place in Chicago.
Normal age anywhere from 40 to 60. Some people go as low as 35, but we talk about an average age somewhere 47, where the time...
Today, I want to give you a high-level recap of what I learned or what I heard in the meeting, and also talk to you about some more nuanced information that is really important for a particular subgroup of women or subgroups of women. So please keep watching. I believe you will really gain some insight from what I learned or what I heard during this meeting. So let's dive in. So at a high-level recap, the theme of the meeting was artificial intelligence and midlife, women's health. Are we there yet? There were experts across all fields, including OB/GYN, cardiology, dermatology, psychiatry, internal med, neurology, pharmacy. We had representation from my side of the field, and then you have other sides that were also represented at the meeting. Some of the big themes that were in place for this year's meeting included support for menopause funding, as well as are we doing too much to delay menopause? That came up in one of my videos that I posted maybe earlier this year about why aren't more women taking hormonal therapy? And there was a comment saying that we don't need to delay menopause, we don't need to alter the course of menopause, but it's more nuanced than that, I believe. Also, why the split amongst healthcare providers and what they're recommending. Now, of course, you must assess each patient on an individual basis, so you're not going to give all patients the same things, but still there should be guidelines that are going to be followed, that should be followed, especially when it comes to evidence-based medicine and providing patients with medicine. Also, of course, the use of AI or learning how to use AI and how AI is accessible in medicine and what are the pros and cons of using AI in not only diagnosis but preventative medicine. That was a really big theme, issue, things that we were discussing during the meeting. And then finally, is menopause a disability? That was a really important question that was asked towards the end of the annual meeting. Is like, well, if women are experiencing so many debilitating issues during the menopause transition, can it be considered legally a disability? So those were some of the big themes. Now, for women over 40, as it relates to women in midlife, we talked about, of course, vasomotor symptoms, diagnosis and treatment, any new things that are coming out in terms of pharmacological products. We talked about genitourinary syndrome of menopause, insomnia, substance abuse, female pattern hair loss, and obesity. I'm going to get into some of these things in today's video, but I think what's going to be best for me is to break it up into smaller chunks and post those videos subsequently. Now, for women under 40, there's also things we discussed in terms of primary ovarian insufficiency, risk of additional health complications, and setting expectations about fertility, as well as polycystic ovarian syndrome. So these are some of the topics that we hit upon or that were hit upon during the meeting. Now, where there is room for growth, there is plenty of room for growth. Number one, Black women's health. That came up several times during the meeting by the clinicians, by the researchers, who were really, of course, concerned with what we're seeing across the health spectrum, not only from like adolescence and puberty to teenage years, but also to maternal health with Black women, and now menopause health with Black women. And I'm going to dive into that a little bit more in this video, and then definitely I'm going to follow up more and more videos on that. And then we also discussed the health of Latina and Indigenous women. There was actually a cognitive behavioral therapy one-on-one course that was in conjunction with the Menopause 101 course. I took the Menopause 101 course, but you can go back and watch the cognitive behavioral course. You have to purchase it, but there was a lot of discussion about cognitive behavioral therapy and how it not only can help with some vasomotor symptoms, but also with insomnia and things of that nature. And then there was also an opening to diversify research. We've been saying this for years, or researchers. I'm a researcher primarily. That's where I started my career, as a researcher, as a bench researcher. And in the field of research, when you talk about clinical trials, there is a gap with seeing more people of color, more women in research. And that is a known fact. There are reasons why this happens. What was talked about was that getting recruitment and getting people involved may not be the issue, but the retention, keeping people along the path of following them during the research might be an issue. But then you also have some maybe distrust issues with people enrolling in clinical trials and trying perhaps products that are not FDA approved yet, or perhaps being taken care of in the best way, shape, or form when you're in clinical trials. So I do understand why there might be a gap in the research, but outreach is necessary. Enrollment is necessary so that we can understand why we are having so many health disparities in the Black community. And then there was also talk about funding for research. So I don't have the particular numbers here. I have pages and pages worth of notes. I'll try and find the particular slide that talked about how research funding it's improved over the decades, but it's still lacking in terms of women's funding. And I'm going to leave those particular numbers because I do want you to see it, and I do want you to understand how it's progressed, but how it still lags behind research overall. And that includes AI research, research in clinical trials, research for pharmacological products, a whole slew of areas where we're still lacking as an overall system in getting adequate funding for women's health. So that's something that I want to share with you. Now, when we talk about Black women's health, I've talked about it on this channel multiple times. I think I need to talk about it more on this channel, not only as a Black woman, but as a healthcare provider, as a pharmacist, as a researcher. So with regards to menopause, the most important and useful data that we have right now is the SWAN study of women's health across the nation. It enrolled 3,000 women into a study. They were in their, I think, early 40s in the 1990s, and they followed them across the decades. So many of them now in their 70s or 80s, and they tracked women and their experiences with health, cardiovascular health, metabolic health, menopausal health. So these women have been tracked for years, and what we have come to know is that Black women experience vasomotor symptoms longer and more severe over the years. I think on average, Black women experience these symptoms 11 and a half years compared to maybe 6.5 for white women and then 1.5 for Asian women. And so there's a lot of bewilderment in trying to understand why this is happening. Some of us may say, or some of us might say, well, there's institutionalized racism, there's stress in our communities, there's genetics nobody knows just yet. There's not enough data and enough research to say if anything is genetics. That's also a touchy subject. And all these things, minus the genetics, there is a lot of issues within our community, within certain systems that can play into us having a harder time health-wise. But we really need to understand what's going on so that we Black women can help ourselves. And that's something I'm going to dive into specifically on this channel, because I've been there, done that, and I understand 100% that more and more is needed to help us. Now, another thing that I wanted to say, it was also discussed about the mortality from triple-negative breast cancer being very high in Black women, and that even though women get mammograms, there was an issue with the breast tissue being so dense that mammograms aren't very helpful. And this came out of the University of Chicago research. I'll try to link that here or talk about it in a subsequent video, because there was so much rich information that was being shared. My hands started cramping by day 2, day 3. I do have the slides, so I'll try to share them with you. And then there was also talk about cardiometabolic diseases that were seen higher and earlier age-wise in Black women, and I've spoken about this. Black women having a higher incidence of cardiovascular disease, obesity, insulin resistance, so diabetes disease. So there are so many things that we can discuss that we really need to get on top of. And then also with the SWAN study, it was seen that Black women have poor sleep quality, which led to poor cognitive performance. That should give you really like an oh shoot moment, because if many women in midlife, these are women mid-career, they're taking care of teenagers and young children, maybe taking care of their parents, and they're having issues at work, then it's like, okay, so what about black women? What, in addition to all the same things that other women are going through, you have these things that are stacking up against black women. And then there was also discussion about female pattern hair loss, the number one cause for black women being scarring alopecia. And then there was talk about the issue of probably braids and ponytails being too tight. I'll probably get into that later. There was a great talk by a dermatologist also out of Chicago. He talked about female pattern hair loss and the treatment, which is for alopecia in menopausal women, being minoxidil in conjunction with perhaps spironolactone or finasteride or dutasteride. There are so many issues with regards to black women, and they talked about it, but there's, like I said, there's still a gap. How do we help black women during the menopausal transition and even before reaching menopause transition, right? Okay. Now, the Menopause Society does have certain stances and position statements that's going to be normal for any society. One of the things that came out was hormone therapy is not to be used to prevent dementia or Alzheimer's disease for women in transition. There is a caveat using it in women who are experiencing primary ovarian insufficiency due to bilateral oophorectomy or the removal of the ovaries. So that's separate, but normally in women who are transitioning through menopause, we're not saying we're going to give it as preventative care. We're not giving hormone therapy as preventative care for Alzheimer's or dementia. The focus is going to be on other things like diet, nutrition, exercise. Also, as a side, there was a caveat saying all women under 30 should have genetic testing. I'll probably get into that in another video because, like I said, there was so much rich information during the meeting. Now, we also talked about women under 45 with vasomotor symptoms and irregular bleeding should consider oral contraceptives first instead of trying hormone therapy. And that being, when you're in this transition, your estrogen is fluctuating. It's like up and down, up and down, up and down. So you still have some estrogen there. We just need to stabilize your estrogen levels, and oral contraceptives from their position statements and from what was discussed in the meeting is the best way to stabilize if you're having this irregular bleeding during your transition period. Also, the stance during the meeting from the Menopause Society is just say no to testosterone pellets. I know there are some physicians who have shown themselves inserting testosterone pellets on this platform, but the Menopause Society says no, because once you insert that testosterone into the upper buttock area, you're not going to be able to get it out. It has to dissolve. Another thing is levels fluctuate. You might get this high intensity burst of testosterone. You might feel great, but then it might decline, and it will decline, and it can be erratic, is what essentially they were saying. So it's going to be hard for you to maintain steady stable rates of testosterone if you have a pellet injected into you. And I can talk about hormone pellets or testosterone pellets in an additional video. Another thing is they also said no to compounded obesity products. Now, there's an issue because if it's not available, then you have no choice, right? If you can't take what's available on the market or don't have access, then this is an alternative option for you. But they are against, I should say, they highly recommend you trying an alternative, not the compounded obesity products. I'll link the slide hopefully for you here. And then also the use of supplements aren't evidence-based, so there's limited data to support the use of supplements from their society, from their stance, but there were some clinicians who did or do recommend using supplements, mostly vitamin D, but there are some other supplements that were also mentioned, which I'll probably get to in a later video, because for me, I do talk about supplements on my channel for overall well-being and health. I do understand that they are not FDA approved, and if you're not having a supplement that's third-party tested, or you're not taking or ingesting a supplement that's not third-party tested, then you might have issues with the availability of the product, with the sourcing of the product, and how well and efficacious it really works. Now, if you have questions, specific questions on the meeting, I want you to let me know, ask. I am going to be producing a lot of information on what was discussed in the meeting, and I think this is a good direction for us to go in right now, because menopause is having not a moment but a movement, as it was mentioned in the meeting, and I think it's really important for us to discuss these topics, especially as women who are over the age of 40 really need to understand what the menopause transition is and how they can better prepare themselves to go through this transition. That's why I created a health guide called Pause and Prepare. I'll link it for you below. And I don't want anybody to be scared. I'm not here to fearmonger. I'm just here to talk about a transition that's going to occur sooner or later for all women who are aging, who are still here with us, who are still here. You're still here with me. I'm here with you. We're going to age, and we're going to go through that menopausal transition if we already haven't. So I'm going to focus on discussing topics that affect us, and I do want you to let me know what it is you want to hear, what you want me to dig into. I'm open to suggestions, and I really want us to enjoy what we're discussing and really pause and prepare for how we can better support ourselves. Now, I'm going to end the video today because I hear a lawnmower going off behind me, but thank you for watching, and stay tuned for more menopause information. Take care. Bye.